So first, this is a correlative study from the SWOG 1605 trial. So important to know a bit what that study was. It was a study for patients who were BCG unresponsive non-muscle invasive bladder cancer, and they were treated with Atezolizumab. So what we've done, we used a UTDNA test in order to assess if the test was able to see the risk of recurrence or progressions of the cancer of the patients who were under treatment. So the test we use to assess UTDNA the name is called UroAmp by Convergent Genomics. So it does genomic profiling of the urine samples for those patients who were under treatment. So we used this test in order to see if there was any genomic variants that were of concern, and the test gave us some kind of results. So we worked a lot with the team from Convergent in order to get the test result and see how we can use this in the results and how we can use to see if the risk of recurrence of the patients. Of course, always done in terms of giving the result was blinded from the outcomes. So once we have those, we saw if patients at the baseline samples or at the 3-month sample, if they were at higher risk of recurring. And in fact, we did found that patients who were tested as being UroAmp positive versus negative, so having UTDNA or not, so those who had a positive test were almost 3 times more likely to recur by 12 or 18 months compared to patients who were negative. And the same trend was seen as well while patients were under treatment with the 3-month urine sample. So 2 things we can say is first the risk of recurrence, and that can help patients if they found a study entry to be BCG unresponsive. If they wanted to go on a bladder preserving treatment like Atezolizumab, that could perhaps help them make a decision. Do I want to try to spare and keep my bladder, or do I want to try another line of treatment such as Atezolizumab? And for some patients who are eligible for cystectomy, maybe that difference, having that score from this urine test, might help them take a decision to say, you know what, I see that I am UTDNA negative with that test. Maybe yes, I have higher chance of, from this, from the work we've done, I have a higher chance of responding to the treatment. So I'll take my chance and I'll do it.